The collaboration with pharmacists, such as Dr. Pilata, in HIV is totally in the hierarchy of interprofessional collaborations with pharmacists and all my other hats and immunodeficiency and autoimmunity. That all pales to the issue of HIV. This is a very, very complex armamentarium right now with multiple medications, literally dozens of medications, with so many dimensions for consideration in terms of drug-drug interaction, interaction with comorbidities that frequently arise in the setting, including substance abuse, depression, hepatitis B and C. It would be inconceivable for me to practice without this type of collaboration on a high volume basis, or at least have some ready access to it. I think it's one of the greatest services that we can offer, and it's very comforting for me to see Dr. Pilata there in the clinic and do either an informal shout out or actually come in and see one of our patients and counsel in essential service.
So most of the patients that we're seeing that I will see for the first time are going to be the new diagnosed patients, which I talked about a little bit before. So we talk about their day. I do a complete adherence assessment to see their daily schedule, activities that they do, what social support do they have, what insurance coverage do they have, and do we need to send them over to the social worker to help out with paying for the medications, what their overall mental health status is. And then from there, I can kind of decide where we need to go with our discussion. Is it, let's just talk about the disease state to get you to understand what's going on and how medications will help that? Are you ready to start therapy right now and we can go over side effects and adherence and things like that? Or are you a patient that has been on therapy for a really long time and now all of a sudden is just not feeling like they should be taking medications anymore? And do we need to reevaluate the entire picture and find a new strategy to help increase their adherence and their understanding of the disease state? So it's a big learning time, and I like to see every single patient and kind of assess where we need to go at each individual appointment. Sometimes we're just there to talk, other times we're there to make changes. And other times we're there to just get a refill or fill a pill box or take one step to getting them closer to 100% adherence. Yeah, some of the other things that I help out with is chronic disease state management, hypertension, diabetes counseling, dyslipidemia counseling, a lot of diet, exercise counseling, because many of our providers are also the primary care doctors for not only HIV, but all of their other comorbidities. So we work together as a team to tackle all of these different things. They may not all get addressed at each appointment as to not to overload the patient, but if we can make a few steps at every appointment and continue that dialogue, it's very important to continue that. I have some patients that I talk to every week, and just to see, if they've kind of fallen off the bandwagon or restarting therapy and had some compliance issues in the past. We'll go over all those things and we'll do a weekly phone call. Others that have come in to see me once or twice, maybe I'll give them a call in a month or so to see how they're doing if we implemented a new strategy to take their medications. Other patients I'll see, every time they come in to see the doctor, which could be anywhere from every 1 month or 1 month away or 6 months away, depending upon how well they've been controlled. So it's a wide range. I get phone calls all the time from patients requesting copay cards or, just needing a little more encouragement. So I leave it very open to each individual patient's needs.